hiatal hernia, there's a couple different versions of them. The one that I usually work with clients on is the sliding hiatal hernia, which is by far the most common. And what that means is the stomach kind of pops up into the esophagus. And so we have a little sphincter or valve that closes off. But when you have the stomach in there, it doesn't close. And so when it doesn't close or open properly, you get acid reflux. And also you have like pain, like right here, right under the rib cage, or the sternum, I mean. And it's pretty localized there for a lot of people. And it also affects the diaphragm. And that's how we breathe, right? And so if we have a fist basically jammed into our diaphragm, it makes it really difficult to breathe and not feel anxious and to be able to digest our food properly. There's a lot of different causes, and I don't think there's just one. So things we do know for sure, like people that get pregnant and have children, they're more predisposed to getting it because their tissues are a little more lax, as well as elderly people over 60. It's super common to see. Clinically, I have only had 2 patients in my entire career so far, including when I was a student, that I assessed for hiatal hernia that did not have one. So I'm always shocked when people come back with their endoscope tests and it's like, no, I don't have a hernia. And then we get them in the office and it's like, well, you've got a tense stomach there. But so causes, some of them include like a direct blow to the abdomen, which kind of makes sense. If you have a bunch of pressing on the guts, you're going to pop the stomach up. And this goes with coughing and vomiting, or like really straining on the toilet as well. Those can all create what we call negative pressure, and that pulls the stomach up into the thorax or chest cavity. And of course, improper lifting techniques, that's a super common one with hernias. But some of the less common known ones are posture. So when we're sitting slumped over our desk, I get like this too at the end of the day, and we put pressure right there where our stomach likes to live. And that creates, again, that pressure differential and pulls the stomach right up. And, I went back and forth with a colleague on this about the low stomach acid being a contributing factor. But I actually do think that it's at least there's a relationship there, because again, if your sphincters aren't closing properly, which they get a signal from the stomach when there's adequate stomach acid to close, and it's not getting that message, and say you're stressed out and you're working a desk job and you're slumped over, you've just added insult to injury, and like your chances of developing a hiatal hernia are significantly increased, in my opinion. I would say can't make that assumption. Some people, yes. I would say probably most people, because most people are, we're human, right? We drink soda and we drink beer, and we don't eat a lot of fiber in our diet, and this just like adds, again, that insult to injury already. But I'm one of those people that like never and always. That's not true in medicine. It's very individualized. So heartburn and reflux for sure, but not everybody experiences that. So I've run into the condition called LPR, or silent reflux, and I'm really curious to actually work with a patient that's been diagnosed with that to see if there is a relationship there. Esophageal spasms, so maybe you've heard of a procedure, I think it's a manometry, that they actually put a tube down your throat and like expand your esophagus. But again, if your stomach is creating that pressure, so esophageal spasms, the lump in the throat, the dysphagia, difficulty swallowing, chest pain, H. pylori infection, nausea, belching, and then the breathing problems, like I mentioned already, like your diaphragm is being crushed, it has a fist jammed into it, right?